Well, Dr. Megan Hammel, thanks for joining us today, and I appreciate your willingness to be interviewed and talk about kids and what's going on with them and some of the challenges they're dealing with. But before we dive into that, could you give us just a little better background on what you do and how you got involved in naturopathy?
Sure. So I'm Dr. Megan Hammel. It's been really nice to meet you, Dr. Isaac, as another part of the community working with these populations. And I'm really grateful to be on the recording today. So I started out with working in conventional care, actually, like in pediatric hospitals, and just saw such a need for more holistic care providers, especially around these complex disorders. I saw a lot of really discouraged parents that just weren't getting the help that they wanted or needed outside of that conventional, medications and therapies that weren't quite bridging the gap of where they thought their child really could be. And so I just saw such a need for that. And so throughout my education, when I found naturopathic medicine, I knew I wanted to work with kids, and the philosophies of naturopathic medicine, which I'll kind of touch on in a little bit, just really aligned with my personal beliefs. And the optimization of health just feels like one of the biggest imperatives for my life's purpose. And so that kind of found me in naturopathic medicine, which really aligned. I went to Portland and I did 4 years there with specialization in pediatrics. And now I'm a board member on the Pediatric Association of Naturopathic Physicians, where we're trying to increase advocacy and, help more naturopathic doctors be prepared to treat children.
Okay, excellent. All right, well, let's dive into a few other questions here, but what are some common misconceptions that you see around pediatrics and naturopathy?
Yeah. So the first one that immediately popped into my head is that the assumption is that we are all anti-vaccine, and that is not an accurate statement. We tend to approach vaccines, and I can't speak for everyone, but for myself, from an informed consent perspective. And so weighing the risk of the vaccine versus weighing the risk of getting the illness, and really making individualized choices about that, and helping parents feel really educated and empowered in making those decisions for their families and for their children, and not in a way that's really shaming regarding any of their questions or beliefs. And so having a really open dialogue around that, and using all of the tools that we have, which includes vaccines, to really optimize people's health and prevent, major illness. And so I kind of lay somewhere right in the middle, and I really like to advocate for both. And some people are really scared to call me because they aren't vaccinated. And then I have people who are fully vaccinated who are scared to call me. And so I think just kind of opening that up to say, we are really about informed consent and about holistic health. And so it really opens the door for people to be able to have those conversations in a really safe environment, and feel really good walking away from those conversations. So that's the first misconception that comes to mind. The other one is that we don't receive adequate medical training, or we're just trained in holistic herbs and nutrition. But actually we receive a very extensive conventional medical training. So we do cadaver labs, we're taught pathology, we're taught pharmacology, on par with a lot of the DO and MD programs. And so we have that language and that understanding to collaborate and work with other providers really well, and be able to advise really well, because we have kind of a breadth of what we do and refer when appropriate.
Gotcha. Yeah, definitely having an open conversations and that informed consent of understanding both sides of the story are definitely hugely important. I agree with you on that. So
yeah,
great. So where's some of the more common conditions you'll see, as well as which ones do you enjoy working with the most?
Yeah, so I specialize in neurodevelopmental disorders. So that's kind of a big part of what I do, which is how we connected a little bit. So autism, ADHD, sensory processing disorder. I have a special affinity for them because oftentimes these patients, again, have struggled to find help elsewhere and kind of have hit roadblocks in terms of the treatment. And I also talk about a lot the idea of diagnostic overshadowing, where we see patients where a lot of symptoms that they're having or things that are going on are just kind of brushed under the diagnosis of autism symptom or the diagnosis of sensory processing rather than really being treated like an individual and addressing those issues. So I really love working with that population. The other thing I see tons of is eczema, allergies, and asthma, the kind of the atopic diseases. I have a passion for balancing the immune system and really talking about why we're seeing this shift towards atopic diseases and really how to manage that from not just a symptom picture. I also do mental health with anxiety, depression, oppositional defiant disorder. I've had bipolar, schizophrenia, GI issues. Constipation is a really common one that I'm seeing a lot in younger populations and older. And then autoimmunity and genetic disorders as well. So kind of a lot of everything, but the most I see is neurodevelopmental, atopic diseases, and then I love helping the people who need more help. And I really love having help who don't have and optimizing their health from there. So doing prevention and general wellness and nutrition is so much fun because I get to like talk about the things that keep people healthy and not just like how to, manage and kind of step back out of these disorders. It's kind of when they're doing really well that it's really fun to kind of say, how can we do better? How can we keep them really healthy?
Yeah, that population definitely usually doesn't have just one diagnosis of ADD or ADHD or on the spectrum. They also have anxiety, they have allergies, they have all these other problems. So, yeah. All right, well, great. So when you're evaluating a sensory kid or spectrum kid, what are the areas you're assessing? Since a lot of times they may already have these diagnoses, but through your unique lens, as far as how you're addressing or looking to address these kids, how are you, which areas are you evaluating and all that?
Well, from a holistic perspective, all the areas, right? We look at the environment, we look at gut health, we look at their neurologic functioning, we check on their immune balance and genetic factors. So we kind of evaluate a lot of different areas, anything that could be contributing to the symptoms they're having. And really, in order to kind of target down to the root cause and understand that, I take a very, very, very thorough history and a timeline of events. I know I do functional testing as well, and I try to use that very judiciously and use testing where it's appropriate. But I think that history and how the child evolved and even the maternal history going into pregnancy and preconception is really, really valuable in showing some indications for certain genetic predispositions, immune imbalances that are happening even at those really early stages that I can give us more direction as to guiding, doing more advanced testing or guiding initial treatments to say, clinically, it's really looking like there might be an imbalance in this area. It might be worth it to just start addressing that or then go on to do additional diagnostic testing. But I try to be really mindful of my patients, financial investment, time investment, and really meet them where they're at as far as what they are wanting and willing to do at this point and how we can best move forward for this particular child.
Okay. So what are some, I guess the best way of putting this, what are some more common interventions for these kids based off of what you see with the results of the tests?
Yeah, so oftentimes, and this kind of goes down into like addressing the needs, but I look at removing barriers to healing. So some of these can include infections, it can include toxins, it can include environmental factors that are coming in and kind of causing irritation to the nervous system or to the immune system. So removing a lot of those and then supporting the underlying healing process and what the body actually needs from a nutritional level. Starting with that is a very like basic level, and it can sound really basic to parents, but if a child is iron deficient, that can present as ADD and ADHD. It can present in worsening of autism. It can present in like more allergic and atopic issues. And so really addressing these simple things to start off with and make sure that that baseline is set is really important and imperative because children really present a little bit differently than adults. Whereas like iron deficiency in adults really looks like fatigue and these kind of things we would expect. But in a child, we can really see these things present in different ways and different manifestations, whether that's abdominal pain can be anxiety, and anxiety can be abdominal pain, and so kind of vice versa. And so I think really evaluating the fundamentals of health, healthy diet, healthy sleep, stress and environment, and then removing those barriers through evaluation. Oftentimes with these conditions like autism, ADHD, there's always a gut issue going on. And so really evaluating whether there's overgrowth of inappropriate bacteria or pathogenic bacteria or viruses and really balancing that out does so much to help the symptom picture.
Excellent. Well, that's a great little snippet and insight into what you do, because I know there's so much more. And for people that are wanting to get more information or to reach out to you, what would be the best way for people to reach out if they have more questions and want to connect with you?
Yeah, my website is really the best place. There's a couple different ways to contact me through that. You can schedule a free 15-minute consult through the website, and that's a great way to coordinate talking to me about your child's specific issue and kind of getting an idea of an approach, and really just making sure it's a good fit for you and your family. There's the phone number there. There's email there that you guys can reach me at. The website is the number 4, coloradokids.com. And that's really the best way to get hold of me.
Okay. Excellent. Do you have a introductory phone call with people before they come in, or?
Yeah, that's that free 15-minute consult.
Okay.
And so they can schedule that through the website, and that's kind of our pre-screening.
Sure. Yeah. Make sure they're comfortable with what you have to say and what it looks like they need.
Totally.
Awesome.
Absolutely.
Well, great. Well, thank you for sharing. I appreciate it.
Yeah. Thank you for asking such good questions. And so it sounds like I have some questions for you about the
Sure.
same kind of things going on.
Yeah.
So I would love to know what the biggest misconceptions are about chiropractic.
Sure. I think what I've found is typically most people think the chiropractic is just for neck pain, back pain, maybe headaches and sciatica. But when, at least the way we look at things, I grew up that way. I got hurt playing sports, and my parents took me to a chiropractor when I had back pain. But that problem continued to follow me throughout my adolescent years, as well as even into my adult years. And what ended up happening was I had a horrible episode, and it lasted for a month and a half. I barely could get my shoes on or pants on, and I was in excruciating pain. And so I was talking to another fellow chiropractor, and he showed me how I'd been addressing things had been more just from the pain symptomatic side. And there was another level of care that I should consider if I'm really wanting to help address this issue. And that really resonated with me, because I'd been seeing other doctors, seeing kids, moms bringing their kids because they're bedwetting or ear infections or reflux and colic. And then I even had the pleasure of being able to work with some kids who are on the spectrum. And just through seeing those changes where they weren't coming in for pain, but they were having these other systemic issues, whether it's with behavior, anxiety, focus, or colic, reflux, and all these other issues, seeing that there was a benefit there, and it wasn't just pain that they were seeing relief from. And when I started changing my mindset towards working more with the nervous system, that opened my eyes up, as well as the infinite possibilities that are possible for the human body when there just isn't any interference involved. It can heal itself. It's an amazing organism that can do some pretty cool things, just as long as there's no interference. And so that's been, I switched gears more. I still help people that have those issues, in the family, but I've been focusing more on helping pediatrics and pregnancies and, families dealing with other problems outside of just neck pain and back pain. And that's the biggest misconception I see, is just people solely think chiropractic is that. And there are definitely a majority of chiropractors that focus on that. And there's fewer chiropractors that have the approach that I do, where more looking at the holistic system and addressing the nervous system to improve its overall function. And that helps the body just function better and be more connected.
Yeah, that's huge. Actually, in our hierarchy of therapeutic order, we call it in naturopathic medicine, structural integrity is a big part of that, kind of like lower on in terms of building up in terms of therapies. And so it totally makes sense that making sure that the nervous system is aligned and is able to communicate to all the different organ systems is going to have a huge impact on health and well-being, outside of just, what we think of as pain. So that's great that you were able to make that shift for yourself and for your practice, because I think there's so many people that can benefit from understanding that, and it being used really gently and beautifully in children.
Definitely. Yeah.
Yeah. So tell me about your philosophy when it comes to chiropractic.
Yeah, well, I think I kind of alluded to that a little bit here just a little bit ago, but oftentimes, people do think of like slips and falls or car accidents as times where there's stress, and but research has shown that there's mild to moderate strain in almost 80% of births. And it's not like a glaring problem where it's like an acute torticollis or like a dislocated shoulder or something, but it's mild or moderate strain to the upper part of the neck where the brainstem comes down. And that is where the autonomic nervous system is really ran through. And so it can throw kids more into a sympathetic state. And so what I like to look at in my practice is the autonomic balance and how well the parasympathetic and sympathetic system are balanced. And they should be pretty close to being balanced. One should not be in dominance compared to the other, really drastically speaking. And so oftentimes I see that that's a problem frequently that starts in our infants because they've had some mild or moderate strain during the birthing process. Even normal vaginal births, it doesn't have to be an intervention like a C-section or vacuum or forceps or even a long or rocket labor type of situation where there's more evidence of obvious strain. But even the normal vaginal births can experience that. And so and that's where I commonly will see, and there's common conditions of colic and reflux and torticollis and problems with latching and all that. And oftentimes, it starts really young. And that's one of my philosophies is I want to work with pregnant population to help and make sure there's a happier home for the child to be in, where there can be stresses that happen to the babies in the womb if there's an imbalance in the pelvic area. And so whether it's a transverse or breech baby or a sunny side up baby, these stresses can predispose them to having these problems in their first year of life. And oftentimes there's something I refer to as the perfect storm. You have these milder strains that happen that have these, I'll just say, these maybe not as significant issues as, say, like a autism spectrum or sensory processing disorder or like significant allergies. But oftentimes we're told your child's going to outgrow this. But the problem is oftentimes they don't actually outgrow it. They grow into something else like asthma and allergies and maybe like sensory or motor problems. And then that grows into more like the sensory processing issues and autism and all these other autoimmune issues that are happening earlier and earlier and more prevalent in society today. And so my philosophy is try to start working with the family as young as possible so they have a more solid foundation to grow from and to develop from and help their family be as healthy and vibrant as possible. And our communities are going to benefit and thrive more with that approach.
Oh, I love that. It sounds like you share that like prevention and getting them younger is always like better because then we're optimizing earlier on to prevent those things from actually developing. And there's so much to be done in those very like sensitive windows. And yeah, like really trusting parents when there's like something's a little off and they're told, by their pediatrician, watch and wait. And that's where it's so beautiful that you and I have a large toolbox of things to kind of say, no, we don't have to watch and wait. There's a lot we can do that's very like effective and gentle and not with a lot of risk involved to kind of, enhance the body's ability to optimize and be the best it can. So I love that. That's really great.
Yeah.
So how are you able to help people with those sensory processing disorders that we kind of mentioned? Like what are you doing for them?
Yeah. So what we usually, I guess I'll just give you kind of like a 30,000-foot view as far as our approach. But usually if a parent is reaching out to us, we'll do a complimentary consultation on the phone, figure out more of what's going on. Is it going to be potentially a good fit? And then let them know, okay, well, here's how we're going to proceed. You can fill out paperwork at home. We'll even, after you fill out the paperwork, we'll talk to you over the phone. So you don't have to bring your child in and have this conversation in front of them as well. And then from there, after we've done that phase of the intake process, then they'll bring the child in where we'll do gross motor, fine motor, ocular motor. We'll test for infantile movement reflexes. We'll also test the nervous system in a variety of different ways. Some of them are computerized as well. And so after we see what's going on there, that gives us a fair idea of where the autonomic nervous system is, how well balanced it is. Oftentimes with most of these kids, the sympathetic is much more in dominance. And so what we've seen with research, and I've even seen in my practice with working with these kids, is that gentle chiropractic adjustments, like if you're testing the ripeness of a tomato, that type of pressure or even a little instrument can be used. So it's not like the twisting and popping type of manipulation that maybe adults think of with chiropractic, but it's pretty gentle, and that helps to reset the nervous system, help better integrate what their sensory reception is. And so as that's changing the way it's being sent to the brain, that information has changed. Now the body's more receptive to understanding what is really happening versus a perceived idea of what's happening that's not quite realistic. Now we start getting better output, and you can see changes in behavior or moods and focus and all these other benefits for a family and that child. And so that's how we approach this. We do some lifestyle advice, watch out for, food dyes and certain foods, try to, focus on, healthier things to do, avoid like the sugary drinks, and try to get exercise, less device time. And so there's different lifestyle recommendations we have, but the bread and butter for us is the adjustments. And the way, because there's so many different therapies out there, like ABA therapy, OT, speech, all these other things. A lot of these kids are inundated with all these other therapies. And so parents have often asked me, well, how does that differ from what we're already doing? And I tell, and like the best analogy I have is, if you imagine a field, a farmer has a field and he didn't plow his field. He just went out to it and threw seed on it, right? And he didn't till it. And what type of crop do you think is going to be grown there, right? Versus if he goes out and tills the field in the spring, then he throws the seed out, how much better and healthier is that crop going to be later in the year compared to the one that didn't have the field tilled? And so for me, the adjustment is really tilling the soil for these kids to be more receptive to their environments, and whatever else they're doing can be more impactful and beneficial for them as well, because the nervous system is more receptive. And it's not just a one-time, I guess, some therapies to me is like a very situationally based, where it's like, hey, do this and this at this time. Where what we're doing is improving the way the nervous system is functioning, not just for right now, but after they've left, their body's more receptive, and they can learn easier with being brought out of that sympathetic state, which is the fight, flight, or freeze type of reaction that is common to see in these children.
That's awesome. I think you addressed a big misconception there too, of like, I think a lot of people think of pediatric chiropractic in the same way they think of adult, which is like the cracks and pops. And all the pediatric chiropractors I work with, including yourself, are much more gentle and cognizant of that, with a younger, newer nervous system, and use a lot of gentle therapies, which is particularly important in a child who is already sensitive, who has these sensory symptoms, whether they're on the spectrum or just with an SPD diagnosis. So I think that's great. And I agree, like the tilling the soil analogy is such a great one. I think of inside out versus outside in kind of therapies, is a lot of that's kind of outside in, and we need to also address the inside out, whether that's from like the nervous system and alignment perspective, or microbiome in my case, and nervous system balance. So I think all of that is so pertinent and so important and really valuable. And I think people can tell, like, we're so excited about these topics because we're just like, we have a mouthful of things to talk about in such a short period of time. But so we'd love to connect with people who want to hear more about this. So how do people connect with you if they're interested in working with you?
Yeah, so similar to you, our website's probably the best option. We have all our social channels are listed there, and our phone number, but it's denver-chiropractor.com. So it's the symbol dash, not spelled out, but denver-chiropractor.com. And we'll do a complimentary discovery call as well with everybody, just to see what's going on and see if it would be a good fit, and get questions answered, and see how we can best help or point them in the direction of somebody else if it doesn't seem like what we're offering is the right choice for them at that moment. So yeah, that's probably the best way to connect.
That's awesome. Yeah. And I totally respect a very similar, like if I'm not the person to help you, I want to find somebody who can. And that, I think that's so respectful in a provider, not to say, oh, we can help everybody and everything, but it's actually like, we can help people who are like, we're going to work well with, and we can send people on to work with other people who will help them too.
Yeah, definitely. Well, thank you for your time. I
Of
greatly
course.
appreciate this opportunity to chat with you and be able to share this information with the larger Denver community, and hopefully even goes farther than that, and it helps stimulate ideas and thoughts where it can help other families or friends outside of this area. So
Yes.
thank
Yes.
you.
Yeah. Thank you so much for your initiative. And it's been lovely talking to you.
Yeah, likewise. Thank you.